Shortage of safe and clean water, poor sanitation and hygiene are some of the challenges faced by the communities in Agago district. When partners under the Uganda WASH Alliance intervened in the year 2017 with the WASH SDG program, a ray of hope for improved living conditions, particularly in the access to safe clean water, hygiene and sanitation became a reality to the communities. In this film, we look at the project actions that have led to the registered improvements in the WASH SDG program area.
The Uganda WASH Alliance Agago Sub-programme is basically a project aimed at increasing access and improving behavior change of people in the Agago community, and is basically anchored on three core objectives. One, increase demand for better WASH facilities and practices. Two, increase sustainable WASH service provision. And thirdly, to improve the WASH governance systems in Agago.
Kubwal Primary School in Kalong Town Council faced challenges of inadequate sanitation facilities. The previous facilities had been collapsing because of the loose soil texture and floods. The school has a population of 417 pupils and 9 teachers who share the same toilet of 3 stances. This led to time wasting and humiliation of the girls who lacked privacy, especially during their menstruation.
Most of our sisters, they have been dropping out of school because of menstruation, mismanagement of menstruation.
They were facing a lot of problems. The toilets were sinking down. Communities, they were trying their level best at least to get a way whereby the facilities could run better, but all in vain.
Through the WASH SDG 6 program, an EcoSan toilet was constructed at Kubwal Primary School to improve sanitation and hygiene.
It's a new technology that has been brought in Agago. It's the first of its kind. We have constructed this facility in 2 schools in Agago district. We have one in Kubwal, which we are in right now, and then the other facility, it's in Ayue.
After the intervention, at least we are getting good change. The learning pupils are getting at least good facilities like to help themselves. And also community, they are also feeling happy when their children are getting some good facilities like that.
In our facility that we have constructed, it has a changing room for girls. In that changing room, there's a pipe that is connected inside the washroom, which help our girls when they're in school during their periods. It is easy for them to go and change, dress up themselves from that room. Then they get themselves in class when they are fresh like any other pupils. We have trained the pupils on how to use the facility. Immediately after using it, after using the facility, you're supposed to put there the hose. There are always 2 pits. One is closed and one is operating. When this one which is operating is full, you can alternate to the other one and close this other one which is full. You open the other one, the fresh one. So after 6 months, you are able to scoop out the waste from this other facility which is full, and that one can help us as manure in our garden.
Kamonoji village in Geregere sub-county encountered episodes of recurrent floods during the rainy seasons. Toilets were washed away by the floods, leading to severe sanitation consequences.
They will be forced out of their houses during rainy season. They go somewhere else until when there's dry season, that's when they come to their home. Even with their latrines, they cannot dig the latrine.
In November 2021, joint efforts to save the environment, GESI, intervened by sensitizing communities on flood control.
We had a community dialogue in the parish of Latinling, especially in Nam Central Village, Kamonoji, and Latinling Nam. We have created trenches of about 1,500 meters in Kamonojui to reduce on the floods in the area. This was after the community coming up with simple, doable actions, which one of them was the making of the trenches and also building of the resilient latrines.
Ever since these trenches were dug, they no longer migrate to other areas, as in going to dig, farm in other areas. They are now doing farming in their home area. The latrines are not now falling so much because of the new technology that they were introduced on. They are now sleeping even in their houses. And these trenches, the way they've dug in a unique way, whereby the water is collected somewhere and their animals can go and graze.
The sanitation facilities under promotion have a slightly raised pit built with bricks and cement with an extra 2-inch extension created on the sides. The raised floor keeps the wall away from the reach of water runoffs, which reduces impacts of floods. Through AMREF Health Africa and GESI, the project triggered 180 villages using the community-led total sanitation approach. This was intended to create awareness on improved sanitation hygiene, hence improving behavior and practices. The program integrated this with other sanitation demand approaches such as community WASH dialogues, advocacy, action planning, and linking households to sanitation service providers.
At the beginning of the project, just like any other, a baseline was done. And in the 180 villages where this project is being implemented, the number of latrine facilities in these 180 villages were about 3,232. That's an average of 17.9, an average of 18 per village across the 180 villages. As of now, after about 4 years of implementation, we have about 8,218 latrines. That is an improvement from averagely 18 latrines per village to about 45 per village. That's an increase of about 4,986 latrines.
Not all households can afford the cost of constructing sanitation facilities. To support such communities, the program introduced community WASH financing, an initiative through which communities could access credit to have the facilities. AMREF Health Africa conducted a series of trainings on formation of village savings and loans associations where these loans can be acquired. Members of Kije Borehole Savings and Loans Association at Kije Village, Amiel Parish in Lapono Sub-County, are meeting to make their payments and following up on their savings. The association was formed in September 2018 with 30 members, and the membership has kept on increasing.
So for them, they started doing the saving by collecting 5,000 for each members. Then again, they go per household and collect 1,000 shilling. And they have been borrowing this money in a way that if one person borrowed 10,000, will come back with 11,000, which the interest is 10%.
Kare no sileng no chwala tin gang kwan pe yela acha den bor group kare mi ori arwen ano upkuno ko dia ana duoko ka kana gama duoko kare lugi ke wegi mo bino per tak machalo liel gene ke kwan sileng kemio leopa.
Open defecation was a severe sanitation challenge in the project area. In January 2019, AMREF Health Africa intervened by triggering communities to create demand for acquisition of sanitation facilities in their homesteads. Clusters of 10 homesteads within the same neighborhood were formed to support each member to construct their latrines. As a result, constructions of low-cost latrines started with the cluster members and the youth, helping the elderly and vulnerable to also construct their own facilities.
No one can wakaro wako idilum. Ero kuberi karma dong kimi phone borwa wan wakonyo choron karilum dong pega. Luak ben dong wa luak gang ichangat. Jam medushu mamege dong bulwa ko gi moy tandara. Bambe dong wa moy wa pedok wa moy lum. Yugi ben dong wa konyo bu yugi dong wa onyo yugi bu yugi.
There were four households that had latrines. So, but now you find that there's a rise in the number of latrines, and also some of them are improved because now the behaviors are changing and they are getting to know the importance of having the sanitary facilities. Not like the previous time that a lot of cases that the children suffer from diarrhea, they are not now, they are reduced. Actually, if you go to the health facility, you find that the number that comes from these villages that we have intervention is lowered.
To ensure total defecation-free status, door-to-door visits were later carried out to identify those homesteads that had not yet constructed latrines. Geregere is one of the sub-counties that suffered effects of the LRA war. Gender equality and social inclusion was at lowest rate, which declined economic and social development. The female gender was less considered in political, social and economic matters of their communities.
In the previous years, people used to undermine women. But now, we have seen when you empower the women with knowledge, you find they do better as compared to also men.
Kijami ruano luare, kidong ngien ko leo, ikarma no chuanma no anpuri, adonya tela no waditi maraj. Chikarma adonya tela, aberu katij matek, aneni leo miero betie, chikubere leo tima be, ribe beti mabe wad kan kuku bene pere kitan madago ni yati tel ni genti ka winya dog ben genti ka nyang purgamo mo ken ko bino makwa ko leo no ati rere ye ku bere ngene wada ni tima be.
Even when the program is in its final year, sustainability of the project activities and its benefits has always been put into consideration. In the course of the 5 years, the capacity of the local leaders has been built, communities sensitized and empowered to demand and increase uptake of proper sanitation options, a hub for sanitation technologies constructed, water and sanitation boards and committees trained, and above all, improved the governance environment by supporting the district to have its own water, sanitation and hygiene ordinance among others.